if you get COVID, you probably aren't going to die. You're probably going to be mildly ill at best. But a subset of people will get very sick and die of COVID, and it is preventable if you get the vaccine. That's probably the most important thing that people need to hear. There's no guarantee if you get COVID that you're going to do well. But we can guarantee you if you get the vaccine, you likely won't get that sick. Since all this started, the best adjective to describe my life is humbling. Humbling because I've been a physician for 17 years and feel like I'm pretty good at it. I've seen many things, feel very comfortable with what I do. And then with COVID, you realize that there's things that you don't understand, that you don't know how to manage yet. What we're seeing now is a new demographic of illness, people who are in their 20s, 30s, 40s, 50s, who are seemingly healthy, taking no medications, probably have felt that they didn't need the vaccine because why? I'm a pretty healthy person, it's not going to bother me at all. But there's no real predictive model to absolutely guarantee that. The only way to guarantee you're probably not going to die from COVID is to get the vaccine. When you see these young folks, peers, people my age, people I know in my own life from my kids' activities and through work, getting sick and dying or nearly dying, as a physician, it kind of makes me feel impotent. I feel like I've done extensive training. I've done medicine training, I've done critical care training beyond that at a very good medical center. I feel like I can do anything, but yet I can't fix these people. And it's like they're on a train ride that I can't stop. And they progressively get more short of breath, they require more oxygen, they go from just oxygen in the nose to oxygen on a face mask. You do everything you can with the right medications that we feel work for this. Next thing you know, they're being intubated. Then we're having to prone them because we know that putting people on their belly redistributes the oxygen. And then invariably with COVID, they get blood clots for some reason. The COVID's very thrombogenic, so they get blood clots, so they gotta go on blood thinners, then they get collapsed lungs. So it's like, you see this time after time, but even though I see it time after time, I can't stop it from happening. And it feels like you're lost, like we're beat before the game even starts. So that's where I said before, it's very humbling because I feel like I can't sometimes fix these people, even though I know what to do and I know what's gonna happen, I still can't fix them. Unfortunately, the vaccine isn't so good that by getting the vaccine, you won't get COVID. We now know that there are breakthrough cases. Either the vaccine doesn't take for people who are immune suppressed, or the immunity wears out over time for some reason. And so you can get COVID after the vaccine is given, but those folks get mildly ill, maybe moderately ill, but they don't die. And so the one fact that people need to understand is if you get COVID, you probably aren't going to die. You're probably going to be mildly ill at best. But a subset of people will get very sick and die of COVID, and it is preventable if you get the vaccine. That's probably the most important thing that people need to hear. And I see that every day. Last week in the intensive care unit, blessing, an individual passed away with COVID who shouldn't have passed away, didn't have to pass away, but because of their belief that they didn't need the vaccine, they got sick and died. Now that's unusual, but there's no real predictive model to say who's going to do well and who's going to do poorly. And so there's no guarantee if you get COVID that you're going to do well. But we can guarantee you if you get the vaccine, you likely won't get that sick. I think the person to reach out to if you are thinking about getting the vaccine but you're uncertain of why to get it is maybe there's somebody from your church who was sick with it. Maybe there's a coworker who had it. Talk to them because they're the biggest and best source for how this vaccine impacts your life negatively, how the vaccine can help you not get sick so you don't have to experience that trauma in your life.